At 2:17 in the morning, a calf cramp can feel like a warning shot from your own body. You sit up, grab your leg, and wonder if this is just aging, dehydration, or something deeper. Magnesium is involved in more than 300 enzyme systems, including muscle function, nerve signaling, blood sugar control, blood pressure regulation, and heart rhythm. And here is the honest number. National data show that 48% of Americans consume less magnesium than their estimated average requirement, with men over 71 among the groups most likely to have low intake. That does not mean half the country is clinically deficient. True, low blood magnesium is less common, but it does mean millions of adults may be running on a low magnesium pattern for years without realizing it. The body is clever. It tries to keep magnesium in the blood steady by pulling from tissues and conserving what it can through the kidneys. So, a normal basic lab test does not always tell the whole story. Low intake can quietly show up as small daily problems that many people write off as getting older. The first sign is muscle cramps, spasms, or twitching, especially at night. Magnesium helps calm the communication between nerves and muscles. When magnesium is low, nerves can become more excitable, and muscles may contract when you do not want them to. That is why cramps and muscle contractions are listed among symptoms that can appear as deficiency worsens. The second sign is poor sleep. This one needs a careful explanation. Magnesium helps regulate nerve signaling and may support normal sleep regulation, but poor sleep does not automatically mean you are deficient. Sleep problems can come from pain, stress, alcohol, caffeine, sleep apnea, medications, or blood sugar swings. Still, if you are waking often, lying there with a wired body, and also eating very few nuts, seeds, beans, greens, or whole grains, magnesium intake is worth looking at. The third sign is anxiety or feeling on edge. Magnesium is involved in neurotransmission and nervous system excitability. Some research links low magnesium with anxiety-related symptoms, though supplement evidence is still suggestive rather than guaranteed. In plain English, magnesium is one of the minerals that helps the nervous system stop revving so hard. When intake is low, some people feel more jittery, tense, or easily startled. The fourth sign is heart palpitations. This is the one you do not ignore. Magnesium, potassium, and calcium all help the heart keep a steady electrical rhythm. If magnesium is too low or too high, it can contribute to rhythm problems, and severe deficiency can be dangerous. If you have new or worsening palpitations, fainting, chest pain, shortness of breath, or near fainting, do not treat that with a handful of supplements. Get medical help. The fifth sign is constipation. Magnesium-based laxatives work because certain forms pull water into the bowel. That does not prove low magnesium is the main cause of constipation, but the same diet that is low in magnesium is often low in fiber too. If breakfast is white toast, lunch is crackers, and dinner is low on beans, vegetables, nuts, and seeds, the bowel has less of what it needs to move regularly. The sixth sign is high blood pressure. Magnesium helps blood vessels relax and is involved in blood pressure regulation. Supplement studies suggest magnesium can lower blood pressure slightly on average, but it is not a replacement for blood pressure care. Think of it as one support beam in the house, not the whole foundation. The seventh sign is constant fatigue or weakness. This is frustrating because fatigue can come from many places: anemia, thyroid disease, diabetes, poor sleep, depression, medication side effects, or dehydration. But magnesium is involved in energy-related enzyme systems, and fatigue and weakness are recognized early signs of deficiency. If your get up and go has turned into sit down and stay there, low intake deserves a look. Here is where this becomes personal. These signs do not just steal comfort, they steal confidence. A cramp makes you nervous about walking farther from the house. Poor sleep makes you foggy with the grandkids. Palpitations make you afraid to climb stairs. Constipation changes how you plan your day. Fatigue makes the chair feel safer than the garden, the store, or the walking path. And the older you get, the more reasons magnesium can slip. Intake may be lower. Meals may become less varied. Long-term acid reducers, such as omeprazole, can contribute to low magnesium in some people. Water pills like hydrochlorothiazide or furosemide can increase magnesium loss through urine. Type 2 diabetes, chronic diarrhea, Crohn's disease, celiac disease, malabsorption, intestinal surgery, and heavy alcohol use can all raise the risk. But this is not a panic story. It is an action story. The best first move is not to buy 5 bottles of pills. The best first move is to rebuild magnesium into your meals, because magnesium-rich foods bring other helpers with them, like fiber, potassium, healthy fats, and plant compounds that support bowel regularity, blood pressure, and blood sugar. For adults over 51, the recommended daily magnesium intake is 420 milligrams for men and 320 milligrams for women. You do not have to memorize those numbers. Just remember this: seeds, nuts, beans, greens, and whole grains are your magnesium backbone. Start with pumpkin seeds. 1 ounce of roasted pumpkin seeds gives about 156 milligrams of magnesium. That is a powerful amount for a small serving. Sprinkle 2 to 3 tablespoons on oatmeal, yogurt, soup, or salad. This supports the systems involved in muscle relaxation, nerve steadiness, and blood vessel function. Next, use almonds. 1 ounce of dry roasted almonds gives about 80 milligrams of magnesium. Almonds also bring healthy fats and some protein, which can help you feel satisfied, and may support steadier blood sugar as part of a balanced meal. A small handful in the afternoon is more useful than a sugary snack that leaves you tired an hour later. Add cooked spinach. 1/2 cup of boiled spinach gives about 78 milligrams of magnesium. It also brings potassium and other nutrients that fit a heart-supportive eating pattern. If plain spinach does not excite you, stir it into eggs, soup, beans, pasta, or a side dish with olive oil and garlic. Bring in black beans. 1/2 cup of cooked black beans gives about 60 milligrams of magnesium, plus fiber. That fiber matters for constipation, cholesterol patterns, and blood sugar steadiness. Try black beans in a salad, soup, burrito bowl, or beside eggs at breakfast. Chia seeds are another rich source. Use 1 to 2 tablespoons daily in oatmeal, yogurt, or a simple chia pudding. They are small, but they help shift the whole meal in the right direction. Then swap refined grains for whole grains. White bread, pastries, many crackers, and sugary cereals are usually poor magnesium choices, compared with whole grain options. Refining removes parts of the grain that contain more magnesium. Even 1 or 2 swaps a day can change your intake over time. Here is a simple magnesium day. Breakfast is oatmeal with 2 tablespoons of pumpkin seeds and 1 tablespoon of chia seeds. Lunch is a salad with 1/2 cup of black beans, and half an avocado. Dinner is salmon or chicken with 1/2 cup of cooked spinach and a whole grain like quinoa or whole wheat. Snack is 1 ounce of almonds. That is not a perfect diet. It is a realistic pattern. If you struggle to get enough magnesium from food, and you and your clinician agree a supplement makes sense, there is a supplement option I trust through the link in the description below. It should support the food first approach, not replace the seeds, beans, greens, and whole grains that do the deeper work. Be careful with supplements, especially if you have chronic kidney disease. The adult upper limit for magnesium from supplements and medications is 350 milligrams per day, not counting food. Magnesium is also found in some laxatives and antacids, and too much can cause diarrhea or become unsafe when kidney function is reduced. More is not always better. This week, do 3 things. First, add 1 magnesium-rich food every day, such as pumpkin seeds, almonds, black beans, spinach, chia seeds, or whole grains. Second, look at your medication list and ask your doctor or pharmacist whether a long-term acid reducer or water pill could affect magnesium. Do not stop prescribed medicine on your own. Third, take a 10-minute walk after a meal when you can. It helps blood sugar control and bowel movement, and it tells your body you are still in charge. Your body is not betraying you. It may be asking for materials it has been missing. Start with 1 meal, 1 habit, and 1 honest look at the patterns that got you here. Small changes repeated daily are how you protect your energy, your steadiness, your sleep, and your independence.